So you've figured out that you're infertile and you want to get to the root of the problem. What is the best doctor to go to? What kind of a doctor should you go to?
Once you're diagnosed that you have infertility by either your gynecologist or your family physician, then your next step is to find the right place to go, is to find where the person or the doctor, who is usually a gynecologist, is trained in doing fertility treatments.
Okay, so on that note, talk to us about the different ways to treat infertility.
Simple. I mean, the simple way.
You pretty much said some of it.
So,
yeah.
In summary, I mean, the first thing based on your test, if the man has low sperm, for example, then you focus on the man. Normally, for me as a gynecologist, I'll refer the man to the urologist, okay, to assess him for varicocele or anything that why his sperm is low, and then to treat him accordingly. Because there are medication out there that could help the man build up his sperm. So we have drugs that help to stimulate the ovaries and make more eggs that help them to ovulate. So we have that. Then, of course, if your tubes are blocked, one of the things that we do in that case from the gynecologist perspective, especially for us that are in minimally invasive surgery like laparoscopy, we always advise to remove that tube if it's damaged, because removing the tube improves your chances when you do IVF.
Okay.
So it's always advised to. So we can do that. We can remove the tubes. If you have fibroids, we can remove the fibroids, polyps. So we care about that. And then if all that fails, then you can try an IUI, and if that fails,
what is an IUI?
That's intrauterine insemination. That's
which is the one you said you put the sperm up into the womb in the woman's
during the
womb.
Time of her ovulation. So we time it ourselves, kind of control it.
Yes. Okay.
So we give the woman drugs to stimulate her ovaries, and then we give her an injection that makes us know she's going to release an egg in about 48 hours. And during that time, we get the man to give us a healthy sperm, and then we insert it, and then, hope for the best, really. That is less invasive and also cheaper than an IVF.
Mm-hmm. And IVF is done here in sub-Saharan Africa and in Nigeria?
Yes, it's done here, just that you have to have money to do it. Okay. So unfortunately for those women who are being ostracized mostly and being thrown out of their homes because they have kids, they tend not to be able to afford this care. And because in our area, sub-Saharan Africa, we have issues like maternal health and child health and malaria and HIV, fertility will not obviously be a priority for the government to deal with, even if it's a very significant social issue that needs to be faced, needs to be at least addressed.
I just wanted to ask you one last quick question. Are there complications from fertility treatments that people need to be aware of?
The one complication is multiple pregnancy. I mean, we're in a culture that it's actually a blessing. When you have twins, triplets, and quadruplets, they're like dancing and singing, especially if it's your first children.
Yeah.
But it is considered a complication because twin pregnancies or triplets tend to have higher risk of being born early, like premature, which leads to other risks like developmental delays and issues like that. So it is a risk factor as much as it's a great blessing here in Nigeria. Another thing is ovarian hyperstimulation syndrome.
Okay.
That's when your ovaries are overstimulated. Mm-hmm. And that normally happens when you're giving medications to make more eggs. And so that's why it's very important to do this with someone that is qualified to do it. And most of them will always have their websites, a success rate. So they're really out there. They're out there, doctors that do this, you will be able to identify them. And because this can get very bad. If it's really bad, you can actually have to be in an intensive care unit. in terms of shortness of breath,
Yes.
forming blood clots. So you really get sick if this is not properly
If it's not done in the right hand.
and done in the right hands.
Yes, yes.
Then bleeding or infection, like any other procedure, and of course psychological stress.
Yeah.
When you meet a couple going through this cycle, this IVF, it's really a stressful time for them. It's a stress on their relationship also, because the anxiety of just wanting to know whether it will work. First of all, the stress of taking the injections, running to the doctor every day to check your blood levels, and then you now have to wait to know whether you're pregnant or not pregnant. And when you meet a couple that ends up not being pregnant, it's so sad, because you know that all that went into this. And so it's really, really stressful, and I've seen it really negatively affect relationships. Yes. So that's another big thing, is the psychological stress.
Okay. So lastly, we'll just talk about prevention. Just a couple of things that our viewing audience can do to prevent, to make sure that they're not at risk for infertility. And it's basically a lot around infections. Right?
Yes.
Yeah.
And to focus in this area, the sub-Saharan Africa, immunizations. I don't know why adults feel they don't need to be immunized. Because anytime you ask for immunizations, I don't know, but you need to be up to date with your immunizations, because we know that mumps can make a man infertile, right? Yes. So it's important to be up to date with your immunizations. Again, as I said, sexually transmitted infections. So again, try to monogamous relationships, use condoms when you are having sexual intercourse, and the different things that can help you prevent when you have a vaginal discharge or anything like that. Come to the doctor to be treated effectively, and don't just let it stay for a long time, because that could damage your tubes.
Yeah.
Nutrition, as I said, if you're underweight, malnourished, it can lead to infertility. If you're overweight, it can lead to fertility. So therefore, you have to make that balance. Okay? Yes. And then again, avoid alcohol and excessive tobacco, and things like that. I mean, modify your lifestyle.
Yes.
Be healthy. Yes. If you're trying to get pregnant, the first thing is just get into a healthy state.
Yes.
Eat right, be the right weights, avoid all the excesses. Yes. And I think you'll be fine. Sometimes that actually just works. I had a patient who lost a lot of weight after about 8 years. She lost like almost half her weight, and boom,
she got pregnant.
Without anything. So it does make a difference. It does make a difference.
Dr. Chito, this has been wonderful. Thank you so much. I mean, I'm not an obstetrician gynecologist, and so I've learned quite a bit about infertility through this discussion that we've had. We're really glad that you came on the Health Zone today, and we hope you'll come back again.
Thank you very much. I hope I did justice to the topic, because it's a huge topic and there's so much in it, but thank you.
So we've been talking with Dr. Chito about infertility. Don't go away, because when I come back, I will recap some of the important things that she discussed on that subject. So stay with us. That was amazing. I learned so much about infertility from the things that Dr. Chito shared with us. Here are the main points that she touched on. Infertility is defined as not being able to get pregnant in spite of having frequent unprotected sex for a full year. Infertility is not just a woman's problem. Both men and women contribute to infertility. In fact, in about 1/3 of cases, the issue is with the male. In about another 1/3 of cases, the problem is with the woman. And in the remaining cases, the issues are with both the man and the woman, or there's no cause that can be identified. In sub-Saharan Africa, many infertility problems are related to untreated or poorly treated reproductive tract infections, which could easily be prevented with early detection. A trained obstetrician gynecologist is the best professional to treat infertility. Not a GP, not a quack that's out there, but a trained obstetrician gynecologist. Not all causes of infertility can be treated, unfortunately, and so adoption is an alternative to consider. To lower your risk of infertility, if you engage in sexual activity outside of marriage, use condoms and limit the number of sexual partners that you have. Treat sexually transmitted infections early and properly. And avoid unhealthy lifestyle habits such as unhealthy eating, smoking, excessive alcohol use, illicit drug use, and not exercising. This has been Dr. Toju reminding you, stay healthy.